Welcome to the Cyber Business Podcast, where we feature top founders and entrepreneurs and share their inspiring stories. Now, let's get started with the show.
Matthew Connor here, host of the Cyber Business Podcast. Today, we're joined by Padmaja Sastry, the CIO at Lowell Community Health Center. Padma, welcome to the show.
Thank you for having me.
Oh, thanks for coming on. Before we get too far in, a quick word from our sponsors. This episode is brought to you by cyberlinks.com. That's cyberlynx.com. Do you know if a hacker's in your system? Most people and most companies don't until it's too late and the hacker's already done damage. A hacker's job is to bypass your security, so companies need a way of knowing when someone's gotten past their security. That's where Cyberlinks comes in. We've partnered with the best cybersecurity companies in the world to be able to provide our clients with the best solutions at the best prices. So whether it's managed SIM, SOC, EDR, MDR, XDR, you name it, we'll help you find the best solution at the best price. Find out more at cyberlinks.com. That's cyberlynx.com. And now back to our show. Padma, for those who aren't familiar, can you tell us about Lowell Community Health Center and your role there as CIO?
Hey, so Lowell Community Health Center is located in Lowell, Massachusetts. We serve about 33,000 patients, not just in the city of Lowell, but also from the surrounding areas. We're a federally qualified health center. That means we welcome all patients from all financial backgrounds, and no one is turned away because of their inability to pay. We just don't give them, medical services as care. It's very holistic, provide all kinds of services, including, SDOH type of services. And we are very embedded within the community. So whoever lives in Lowell knows about the organization and our impact in the community. I've been here like 5 years now, and I serve as a Chief Information Officer.
Very nice. So I think if I read this correctly, it was something like, what was it? It was a pretty good percentage. Was it 90 some percent is covered by insurance and the rest by donors?
So there's multiple ways that we provide services to our patients. Majority of this is obviously through insurers, and around 69%, close to 70% of our patient population is covered through Medicaid. And about a small percentage of that is also Medicare. And then another, remaining percentage is for private payers. But we do serve a lot of patients that come from the underserved backgrounds and have been historically, underserved in the community.
Well, it's interesting because I asked because I think that in healthcare in particular, I think that the dollars are really tight when it comes to kind of everything, right? I think insurers have, and I'm just going to throw them under the bus. I think insurers have made it really difficult for everybody in the healthcare industry. And so then as that kind of trickles down to IT and security, it becomes really tough to kind of compete for limited resources, right? I mean, a lot of organizations, some have basically unlimited, resources when it comes to IT and cyber, and that's really nice. But I think that when you get into the healthcare, you're now on the other end of that spectrum where dollars are really tight. So how do you manage that in an organization, where money is tight, you're doing God's work, right? As they'd say in the South, right? And you're doing great work, but you've got really limited financial resources. How do you make all that happen?
That's a great question. And every day when I come into work, that's what I always play in the back of my mind. It says, how can we create impact within the community? Because as community health centers, as you know, we can't always buy the most shiny tech that's out there. Everything that we invest in, we are looking for a value and what the impact is within our community. And if it is really, making such an impact, what is it that we can do to make access and quality of their healthcare better for our patients? So yes, there's definitely limited funds to look into that. But when you kind of are strategic about it and say, okay, this is what the value we're trying to deliver from this, that's when, that if you have that mindset, I think, it is doable, and it is a good strategy to have.
So it's really more of a value add versus a cost, right? So instead of it being like, hey, this is just a cost line item on on the budget, it's more like, look, we're going to add value to our clients, to the organization, to the community. So you've kind of shifted the perspective so that people aren't looking at it as like, oh, well, Padma's asking for more money, right? Instead of it like, but yeah, but we need the money to stay safe, or we need the money to do whatever. Instead, it's now focusing on the value that it brings to make the community better. That's your approach?
Correct. Correct. I
Nice.
mean, the daily demands of healthcare is always going to be there. We still have to meet regulatory requirements. We still have to keep the lights on. We still have to work with the insurance companies. So with all of those demands, we still have to be smart about what we're doing, because, we have close to about 500 employees. We still have to make sure that the salaries get paid, and,
Yeah.
and we provide quality healthcare.
Yeah.
And so when we say that we don't have the most shiniest of the tech, that doesn't mean that we're going to give them low quality of anything. When they come into our organization, they should feel like they've been to one of the best healthcare facilities that is available in Massachusetts. As you know, we have some really big
You got some
organizations
good ones.
in
Yeah.
here, so they should feel like that they are in a similar setting, and the experience should pretty much be the same. And that is basically what my objective is for the patients to feel that way, no matter where they come from or what their backgrounds are. So with that mindset, if you are equitable in terms of the experience that you want to provide, and also, you're not saying that, oh, this shiny new tech that's available, let's see what it can do for us. I'm always thinking about, okay, when there is a need, the need should drive the innovation,
Right.
rather than, well, I have this great software, how about I try it out and see what it does for me?
Yeah.
So kind of that strategy, because we're so mindful of, oh, well, is it helping patients, get their lives better? Or is it helping quality of care? Or is it something that we really need to do for regulatory requirement?
Yeah.
So that's a pill we just have to swallow. But otherwise, we have like all these three different pillars that we need to figure out.
Well, I think that's really smart. I mean, it's two, you've already given two really good kind of paradigm shifts or perspectives on this that I think are really applicable, whether it's in healthcare or just a small, like, even a startup, right? You're bootstrapping, or you're a small organization and funds aren't unlimited. I think, taking that approach, because I think we've all been entranced by the new shiny tech and be like, oh, I'd love to get that. But do you need it? Is it really, like you said, is it just innovation for innovation's sake? And it's like, oh, that's super cool, but does it really move the needle? No, but it's super cool, right? So,
Right.
okay. Right. So it's
Yeah.
kind of like being grown up about it. We got to be responsible with our money. We can't just go spending it on a bunch of cool new toys just because we like them. So I like that. And then focusing on on the end user, the client, and the mission versus just it being something that
Yeah.
Padma really wants because it's a really, really cool toy. So I love that.
Exactly.
Okay, well, let's talk about, I think for a lot of people, they come into tech in a variety of ways. And I really like your background. And I'd love for you to kind of share your origin story, if you will, with everybody, kind of how you got into tech and how you got to where you are.
Okay, so my origin story is essentially, I'm originally from India. I'm a dentist by education and training. When I moved to the US in, I would say 20, I mean, the year 2000, um, uh, there was a thought process that I had to go through and say, this is what do I want to do when I grow up, right? Everybody has to think about that. I feel like, you're never grown up until you figure out what you need to do. So essentially what I did was I wanted to be within the healthcare space, which I knew that was my comfort zone. And then I also was very interested in the technology and its impact on making things better in general, agnostic to an industry, right? So that's when I kind of wanted to get into the health informatics space to see, the impact of technology in the healthcare delivery system across the continuity of care. So that's essentially where I tried to go and got my master's in healthcare administration, which is what they call now. They call it something else, I don't know, but that's essentially what I did. I graduated from UMass Lowell. And best experience I've had going to that university and the mentors, and that opened up a lot of doors for me, including the internship that I first did right getting out of college was a Lowell Community Health Center. And so that was quite interesting. And now it's come full circle. And now I am here as an employee here. So that's kind of my origin story.
I love it. You don't often see, dentist to CIO. That is a very unique path. So was it, I just have to, I'm curious, when you went from India, your dental training was in India and you were a dentist there and you moved to the US. Was it the kind of the having to kind of, did you have to like start over again in the US? And it's like, ugh, to do that all over again is going to be a pain in the butt. What other options are there, or
Yeah,
how'd that go?
yeah, exactly. And yes, it was sort of a combination of those to see, okay, where do I see myself thriving? Well, granted that if I just continued with being a dentist, that would have been something that I would have continued to do for the rest of my life.
Yep.
But is that how I see myself leading a very kind of I wouldn't say a unique life, but what is my impact to the community rather? Yeah, I could
Yeah.
be one amongst many that will be doing the same thing every day. There are thousands and thousands of dentists, but I wanted to see if there was something special that I could be doing in order to serve the community at large.
Well, I think you're preaching to the choir because everybody in tech is like, yeah, obviously you wouldn't go dentist. I don't know of any job in tech where it's the same job, the same job day after day. Every day is a new day in tech, which I think attracts a lot of good talent and a lot of people who, would bore of kind of the same thing. And I think dentistry, while great and much needed,
Yes.
so thank you, Dennis. I think I can certainly understand your choice. So yeah, it's never the same day twice, over here. So, and I would
Yeah.
think that for Dennis, it's kind of the same day every day, right? A little bit of Groundhog's Day, right?
Yeah, so there's definitely a lot of cool things dentists are doing these days,
Yeah, true.
and also with evolving technology, the lines are getting blended.
True.
And so, but what is unique about my background going to be a dentist is also because I can carry that clinical knowledge over
Yeah.
to whatever, and I can think like doctors,
Yep.
and I can see that what this piece of technology was implemented for. Is it something just to check a box, or is it really delivering value? So that's where kind of my judgment comes in.
Yeah, I think that anytime you're on the service end of a business, and in healthcare, as on that kind of service side, I think that helps you, as you move up in the organization and doing anything else. It really you understand, what you're delivering and to who, and now you can better support that, the organization that way. And so I think in tech, I think a lot of people really like you got to start on the help desk when you come to tech because it's on that service side. You start to understand the business better, just because of that, and you understand your clients, and your internal clients better, and the organization better once you've kind of done your time at the help desk. So I think on the healthcare side, same deal. I think that serves you really well to have had that kind of clinical experience to then be able to bring that over to tech. So you really stand out there.
Absolutely.
Well, and I think anytime you think of a community health center, I think more of kind of that small country or town kind of health center where it's there. I don't want to say, you don't think modern technology, right? I don't think that's the first thought. And so Can you walk us through some of the things that you've done to kind of modernize and transform the organization, and, with tech?
Yeah, so it's a great question. Um, Back, if you would ask me this question maybe like 10 years ago, right? 10 years ago, and with all of the challenges as community health centers have had to overcome, uh, it was definitely a lot of barriers that were in place
Yeah.
for community health centers to kind of be on par with the best organizations that are out there. But one great thing about technology is that it's an equalizer,
Yeah.
right? In when 2020 came up, which is when I moved to this role, and then came the pandemic. Um, the pandemic is what I call was the Super Bowl for people in tech,
Yeah.
right? So essentially, where other big organizations were wondering and they were getting overwhelmed, which already had invested in big legacy systems and huge infrastructures, and when they were trying to figure out, okay, how are we going to make this all work in a remote environment?
Yeah.
And trying to figure out, okay, is this enough? Community health centers were there. They were like, yeah, we can make this work. We were given 24 hours to transform our business into 100% remote operational business. So with that came an opportunity for us to say, now is the time for us to start breaking down those barriers of access that always historically existed, and kind of put our foot forward little by little, and then start to make things better for our patients. And then soon enough, by the end of the pandemic, we had put in so many investments into our organization, and we do have the privilege of having our governing boards through HRSA and the support from our local legislators, and also the advocacy work that the Massachusetts League of Community Health Centers does for us. So with a combination, all of that, the first thing that we really had to do was, like I said before, the need has to drive innovation. So we needed for our staff to be able to work from anywhere without even feeling like, oh, can I afford this type of an environment? Because we made a lot of assumptions going into the remote world, if we say, for our staff and patients alike. Then we essentially thought that, okay, let's just go remote. But soon enough, what I realized is that by introducing this type of an environment, we are creating disparities within our patients and within our staff. So we had to kind of like roll it back and say, okay, let's make sure that we are approaching this with a lens of equity and with access, and also not just for our patients, but also for our staff who also come from the community. So initially we rolled out a call center, a remote call center, which was completely 100% on site, made it 100% remote. Then we started to invest in some of the infrastructure that, as a health center, I was looking at and said, this is the opportunity for us to kind of elevate what we have put in investments in and make it a little better so we can support our staff, so that they can take care of the patients more effectively without having to worry about, okay, is my computer going to die? Or, how old is my laptop? Things like that. So those are the type of the foundational investments that I made, and then with great support from our executive team and our board members, which basically, give its reward towards the end and say, okay, now we see why we need to make these investments in technology, right?
Interesting. So then did you end up rolling back a lot of the remote stuff because it wasn't, as equitable? I mean, it made it challenging for you found out that there were the haves and the have-nots, if you will, and a lot of people didn't have access to, to a computer to have a remote, therapy session or whatever, a telehealth session. Is that what ended up happening, or how'd that play out for you guys?
So during the course of the pandemic, obviously we didn't have a choice. We had to
Right.
manage to do it remotely. So we were successful in making things remote, and creating sort of like a good pathway for our patients. For us, access was very important. and the experience were very important, and obviously safety. So during the course of the pandemic, all of the operations were pretty much remote, and we didn't experience a lot of that because at that time we didn't have a choice. We had to
Yeah.
do it. Right now, fast forward towards the end of the pandemic, where things were kind of like, okay, so we're going into the vaccine administration phase, and people are starting to get confident to get out of their houses, and we're starting to get the staff back on site. And then some of the programs that we were doing remotely, we then realized that, okay, so we really need to take now the next iteration of this is to create some sort of like this environment where we are not creating the haves and the have-nots.
Right.
Because I'll give you an example. For telehealth, for example, right? Everybody needed to see their doctor over the phone. So what did we do? We kind of assumed that everybody has a cell phone, right?
Right.
So, but that's always the case, especially with the patients that we see.
Mm.
We soon realized that not everybody has patients. Sometimes a family can share one phone, and there could be like 5 people who need to get access through that. So we very much advocated for grants where they will support us to provide cell phones for our patients, which is kind of something that we realize also that when you give a patient a cell phone, it's not just helping that one patient. It is helping that patient stay in contact with our center, probably also helping their children do their homework, connect to the internet, and pay their bills, call an Uber, get some groceries into the house. So it's the kind of the need that's out there. It's not just health related. It is at many layers to that we soon realized, and we're like, great, access is just not physical access that
Yeah.
patient needs to come and see the doctor. Access is anywhere. We need to go meet the patient where they are.
Yeah. Wow. I mean, you wouldn't think that there would be, I don't know. I guess that's very privileged, isn't it? To even think that, oh, that's probably not that big of an issue for many people these days, right? But yet there are still, um, how can you put kind of a percentage or a number to that? Is this kind of a very small, but but needy, not needy, is it a very small portion of the people you serve, or is it surprisingly a large number? I mean, you said something like 35,000-ish, people that you guys serve a year.
Yes. So if you think about just the percentages, we have about 33% of our patients are below the federal poverty line. And in that context, even if there was, let's say, some sort of a technology is available to them, if we assume, well, we're in the 21st century and everybody needs to have a cell phone to get things done. Back in the day, it was like during the pandemic, I felt like, that was a big assumption that a lot of people made that kind of unintentionally created the digital divide,
Yeah. Did
right?
you say 30%? Just so I heard
Yeah,
that right.
33, yes, 33%
33%.
of our patients are below the federal poverty line. So, and that is just one health center we're talking about.
Yeah.
We have hundreds and hundreds of health centers across the United States. And so now you can understand the impact it will have when
Yeah.
the Medicaid cuts and such, come into play. So that's a whole discussion altogether. But what we ended up doing is trying to have our community health workers who go out into the community, just assess the situation that's out there.
Yeah.
And our patients will say they have a phone, but we just don't need any phone. We need a smartphone.
Yeah.
So then, we have to create some sort of a criteria where we are giving the patients something that they can help continue their care with their provider, and also help with other things.
Wow. I mean, that's more than 10,000 people.
Yep.
So that's wow. And of those, you think that that's maybe another third of them need a cell phone, need that sort of, assistance?
Yes. So, yes, definitely more than that.
Wow.
And we're also challenged by limited data plans and those
Yeah.
kind of things. Those are so many variables that come into play. And also a lot of our patients are also not wanting to use their personal phone for a variety of reasons, for health related reasons. We serve patients with substance abuse. So it's sometimes like you have to think twice. Am I okay to give this phone to this patient? Because there were instances where they have something now in their possession that they could very well exchange for what they wanted to get out on the street. So we have to think about all of these things before we enable our patients with the things we think would be best for them, but sometimes it's something that we are indirectly causing problems.
Yeah. That's eye-opening. That is something. Well, I'm glad you're there to help with that. That is really moving and profound. I think I'm shocked that it's that large a number. And I think that, because you look around, and if you're not in that area, out of sight, out of mind, I think, right? And it's really easy to think that, oh no, everybody in the United States, sure, compared to the rest of the world, we, even, well, maybe not some of them. Maybe that's also a very skewed view of things, to think that just because we live in the United States, we're, the top 1% or 0.01% of the world's population. True, as a general rule, but there are still these margins, of society that are really struggling, and that is really interesting. Well, on that very profound note, let me ask you, if people wanted to help, before we go here, can you tell us where they can look to find out more about Lowell Community Health, and where they can how they can help?
Great question, and I'm glad you asked. Most anybody who wants to help out or chime in, they can go onto our website. It's www.lchealth.org. There are multiple ways that you can get involved. We're always welcoming people who want to donate for all of the different programs that at this present time, we don't know what the future of those programs is going to be where we do want to keep those programs if we possibly could. We never turn away anybody because of, for any reason. But, at some point, we also have to figure out, okay, is this sustainable? We're always looking for opportunities out there for grants for people who'd like to contribute, get involved in the community. There's so many other organizations within the Lowell community itself that are advocating for our patients, for the historically underserved and refugees and immigrants and all of that we have to serve. So, the best way to do that is to kind of, donate.
Fantastic. And before we go, can you tell everybody where they can find out more about you?
So the best way to get a hold of me is through LinkedIn. My full name is Padmaja Sastry. So that's where you would find me. But by way of you, hopefully this word about, trying to support community health centers is going to go out to more people out there, and they see the impact that we're creating.
Fantastic. Well, I can't thank you for all the great work that you're doing in the community. And thanks for coming on. And until next time.
Thank you.
Thanks for listening to the Cyber Business Podcast. We'll see you again next time, and be sure to click subscribe to get future episodes.